For those that don't know, this is the start of Black Maternal Health Week. And this is an opportunity for us to do something that we should be doing every single day of the year. And that is talking about Black women's health, Black women's reproductive justice, Black women's lives. And here to talk to me about that, to help me break it all down, is the legendary Brooklyn's finest, Monifa Bandele. She is a senior vice president of MomsRising, and she does so many other things. The list goes on and on and on. But right now, she's going to break this stuff down for us. Monifa, so good to see you.
Oh, thank you for having me on this first day of Black Maternal Health Week 2024.
2024. For those that don't know, what is Black Maternal Health Week?
Black Maternal Health Week, which was founded by the Black Mamas Matter Alliance, is a week where Black justice workers and Black maternal health advocates all over the country rise up and say enough is enough. Many people don't know that the United States has one of the worst maternal health outcomes of developed nations, and a lot of that sits on the fact that Black women and Indigenous women are suffering and dying, 3 to 4 times the rate of our white counterparts. And so with this horrible maternal health rates that we have in the United States, Black Mamas Matter Alliance has set aside this week for there to be on the ground events, online events. There are doula workshops. There's lobby days in states all over the country. And if you could just imagine like Black midwives, advocates, nurses, doctors kind of storming the state houses and doing community events all within the same week, that's what Black Maternal Health Week is.
Wow. That is important too. That is dope. And it's important that this work is happening. When you say that the health outcomes for Black women in the United States are among the worst in the world, and I've heard that before, what does that mean in practical terms? Like, are we dying giving birth? Are we dying early in the, like, what does it mean? What's going on with us?
Yes, it means that particularly during birthing and labor and up to a year postpartum, Black women are dying. you know, postpartum hemorrhaging, hypertension, preeclampsia. I mean, one of the things that the CDC released is that actually 80% of these deaths are preventable, right? So this is a lot of hospital neglect. It's a lot of not listening to Black women. It's a lot of not responding to people postpartum. And so I'll give a concrete example right here in Brooklyn. I'm from Bed-Stuy. The closest hospital to my house is Woodhall. And in less than 2 years, two otherwise perfectly healthy young Black women have died there, Christine Fields and Shayasia Simple. And Christina Fields, they accidentally cut an artery, and she was bleeding out and was not attended to. And Shayasia last year, not being listened to, was had a tube wrongfully intubated in her. And we see things like this all over the country, and people want to say, well, maybe Black women aren't as healthy. Maybe this is an issue of class, and it is. But what we find is that even when we control for a level of education, class, income, Black women are still dying at higher rates from preventable causes than white women. And so we want everybody to get on the platforms this week. It's BMHW24. That's the hashtag. And find out how to get active in your state. We see it's particularly bad with their banning abortions. I know y'all were talking about that a couple of days ago. These things are connected.
So help me draw that connection, because we on the show here, we were talking about Arizona and the decision to basically go back to a law that's older than the state itself. Arizona, I think, was became a state in 1912, and they're going back to a law that was like 1864, maybe.
Look, Civil War.
Civil War. I mean,
It's
that's
taking us back to Civil War era.
That's
Civil
wild.
War era.
And basically now saying that abortion is outlawed, effectively getting rid of the 15-week rule, and saying that even in the case of rape or incest, you still got to carry the baby to term. Why? How is this happening? It seems like even Republicans are mad about this.
Yeah, and what's ironic is that these people claim to be pro-life. And what happens in states where there's abortion bans, one is those are the states with the highest maternal mortality rate. Those are the states where there's not access to affordable childcare. Those are the states that have not implemented paid leave for when babies are born. Those are the states that have not expanded Medicaid, right? So it's like you push policies that make it difficult to grow a family, to extend a family. And then in the same end, you ban abortions, which also creates a maternal health desert. Doctors are refusing to practice in states where there's abortion bans. They don't want to be criminalized. If someone shows up and they have to make a decision,
Yeah.
is her life really in jeopardy? Maybe it's not. Maybe I don't give the abortion and she dies, or, and so you have places like Georgia where OBs have left the state. So you create these maternal health deserts, which
Mm.
is everything that is the opposite of pro-life, right? So, it's not really ironic. It's actually hypocrisy, but we see a direct line because what you need in order to have a healthy and safe maternal health care system is access to the full realm of reproductive health, right? If you have people who are not doctors, who are not the person who's pregnant, sitting in a room, sitting in a hall, sitting in a state house, making medical decisions for women who are pregnant and for birthing people, it puts everyone in jeopardy who's in that situation. And so it's actually doing the opposite of promoting life. It's making these states more deadly for people who get pregnant.
Why is this happening now? I mean, Black women's maternal health outcomes have always been bad, comparable to the white counterparts. There's always been problems, but it seems like now I'm hearing more and more stories, more and more bad news. Is it that we're getting better at telling the stories, or are things getting worse? What's going on?
Sadly, for young women like my daughters, the birthing outcomes today are worse than they were when my mom gave birth to my brother and I in the 70s. That's
Wow.
crazy. That means we've gone back. Roe
Wow.
has rolled back. We have rolled back. This leaning into the medicalization of birthing does not work in our favor. All the
What does that
C-section.
mean? Break that down for us. What is the medicalization of birth?
It means back in the day, when women gave birth, there was typically a Black woman in this country, right? A midwife in those communities that were responsible, that had a team of folks that gave birth to the babies, both within their own communities and families. But for Black women, we were also the birth workers for even the people who had enslaved us in post-slavery, right? And so giving birth was not something that happened in a hospital. It was not something that was directed by a doctor. Doctors can be involved, but I'm just talking about the shift that has happened, right? And so
Mm.
you have people like Marion James Sims, who you may have heard of, this doctor, who is considered to be the father, right, of OBGYN, who actually tested and tortured Black women to develop the different practices that we see today. So we see something that was in the home, that was with people who looked like us, helping us through something that is a natural process, getting intervention when that was necessary, to an extreme measures really started to take off in the 70s and 80s, where the United States has a high number of C-sections. Everything is done in the hospital. And we know what happens in the hospital with Black people, not just giving birth, right? We saw a woman who's a former congresswoman in Texas recently. Her family is suing because of how she was treated because of medical neglect. So we're in a vulnerable position and we are giving birth. The story I love to share is like Serena Williams, right? Here's one of the most wealthy, powerful, influential women in the country, if not the world, right? And she's having to fight and argue in the hospital to get the treatment that she needs so that she doesn't lose her life, right? She had to demand that they scan her body for blood clots and they were. But imagine if you're not Serena Williams, right?
Right.
Imagine if you don't have that level
Just
of
regular, not
influence
rich, not famous, not connected, just
and
regular.
can't advocate because maybe you just had a C-section, right? So this is why this is happening, and this is why you're seeing a rise in Black midwifery all over the country. You're seeing a rise in doulas because, like with all things, we fight back, right? We want to get back to healthy birth outcomes.
So you mentioned the hospital. I was thinking about when my youngest child was born, and we were in the hospital, and we were worried about all the stuff that you worry about, from preeclampsia to, um, gestational diabetes to, what's going to happen when this baby is born, what's going to happen, like you said, up to a year after the baby is born. These are all questions that people have throughout the process. And we were in the hospital, and it was a good hospital. and we asked questions and they answered them. And the doctor knew that we were professionals, and so they gave us a certain kind of treatment. They answered our questions. They brought us stuff that we didn't even ask for. You know, I can't say that I didn't have a good experience, but I also noticed the doctor was very honest with me, and she said to us, um, everybody doesn't get this treatment. She said they
Mm-hmm.
all get it from me, but other people in the hospital don't necessarily give this treatment. And she said the nurses are often people who make decisions about, they're your direct line when you're not, when you, but the doctors are incredibly important, but nurses are incredibly important. And she was talking about how when people come in from certain neighborhoods and they don't get read as valuable, they don't get read as properly, sufficiently articulate or educated or whatever, they get all kinds of treatment. And she even talked about how like they'll give some people drug tests, you
Oh
know,
yeah.
it's like a punishment.
The policing of our bodies, of our pregnant bodies happens because we're policed all the time. So
Yeah.
even when we're pregnant, even when we're in the hospital, right?
That's wild. And I guess what I'm thinking about is this intersection of race and class, because like you said, it's not a class thing exclusively,
Mm-hmm.
but it's also not a class thing, right? So
It's not a class thing. And just think of the dangerous combination that is both race and class and gender, right? All of those things coming together, making it a triple dangerous situation for birthing people. So, one of the things I like to talk about is that it's systemic. Up until recently, in medical schools, doctors were taught that Black people feel less pain, right? So
right.
if you went to medical school 20, 25 years ago, which a lot of people did, right? This is something that was taught to you at that time, right? And so even if I'm well educated, but you think that maybe I don't feel as much pain as the next person, I'm going to get a different treatment. Or when I say something doesn't feel right, I may be dismissed by you or your team. So these are the types of things that we're fighting back. I mean, they just changed the kidney measurement for Black people to be able to get kidney. I mean, we still have deeply racist teachings that are happening in our medical institutions. So it's systemic. You have this thing of like your class and your race coming together, and we know how Black women are treated. When we are actually doing the advocacy, that's criminalized and considered to be combative. People have seen that written in their chart when they're asking questions.
Oh, they love the
Combative.
people
I want to know
combative.
what you're doing to me.
Right. And that's exactly what I'm talking about. And that's one of the things the doctor was telling me. It was like, okay, if I ask a question or my wife asks a question, it was like, okay, well, we read this study and it said this and this and this, and therefore that. And they're giving us responses. Even if they don't agree with us, they're responding in a certain way. But if somebody doesn't present a certain way or talk a certain way, they may have the exact same concern. I don't think this works for my body, or I feel pain here, or this makes me uncomfortable here. And they get a very different outcome. I was thinking about the story before we go of this brother, Bruce McIntyre. I don't know if you know him. You probably do. But he's a health advocate. He's the founder of the Save a Rose Foundation, and he started it a few years ago when his fiance, whose name is Amber Rose Isaac, uh, she died in April 2020. Uh, she was pregnant. She developed HELP syndrome, which for those who don't know is a syndrome of hemolysis. It's like a what's it called? Microangiopathic blood smear, elevated liver enzymes, and low platelets in people who are pregnant or right after you have the baby. It's something that it's something that can be dealt with, but you got to be able to recognize it. She had it, and they ignored her. They didn't tell her condition, and until the day she was induced for labor. She then underwent an emergency C-section. Her platelet levels were below normal range.
Platelets low, right?
Yes, and she didn't survive. And
Mm-hmm.
she told them that she wasn't okay. She told them before. I mean, she told them throughout the process that she wasn't feeling okay, that she's had problems. They ignored her, and these types of stories happen every single day. And it's like
Yeah.
I don't know what we can do, and I know we can't solve it all tonight. But before you go, just tell me this: what can we do to support Moms Rising? What can we do to support moms? I'm sorry, Black Maternal Health Week.
Black Maternal Health Week, definitely follow the Black Mamas Matter Alliance. They are constantly putting out reports, constantly sharing local efforts that people can join all over the country. So check them out. At Moms Rising, we're pushing a piece of national legislation called the Black Maternal Health Momnibus. So it's 13 bills together that are talking about everything: better training in schools, a pipeline for Black birth workers, holding hospitals accountable who are repeat offenders in losing the lives of Black moms. Like the whole suite of things, everything you could think of is in that momnibus. But then also there's the stuff I named earlier, right? A lot of women are getting into trouble after labor and delivery, postpartum. The United States is also the only developed country that doesn't have a universal paid parental leave program, right? So if you had a C-section and now you've got to be back at a cash register, or you're hemorrhaging, but you still have to show up to work, or you're going to lose your job. That's where we are seeing the policies that we don't have in place, right, for birthing people, causing another layer of danger for them. So we have to put all these policies together: the affordable child care, the paid family medical leave. All of those things help us to have healthy birth outcomes. If we look at countries all over the world, I mean, we could just even close. We look to Canada. They do not have the same maternal mortality rates as the United States. Why?
Crazy.
Universal health care, paid family leave, right? Universal child care. These are the things that will keep mothers alive.
And that's what we want to do. We want to keep mothers alive. We want to keep a focus on Black mothers this week in particular. We care about all mothers, but Black women, Black mothers, Black birthing people, we got to care about, especially because no one else is. Monifa, I appreciate you as always. You got to come back on and break all this stuff down for us on a regular basis, because there's so much work, so much energy that needs to be put into Black women's health and Black women's maternal health in particular. So we appreciate you, and I'll talk to you soon.